Thank you so much for joining us today. This is Nora O'Brien, CEO of Connect Consulting. We're here talking about reopening businesses and schools during COVID, and it is our new normal. It's a situation that we've been living with for a number of months, but people do have to get back to work. Kids have to get back to school, but it's going to look a little different. So that's what the new normal is all about. I want to thank you so much for joining us today. And hopefully this is a time for questions, a time for best practices. So we want to let you know that we want you to ask questions. It's important for us that you ask questions, because our goal is to be able to provide you resources and services and best practices throughout the day. Throughout the time we're together. So the frequently asked questions, we get these questions all the time. Can I get the slides? Can I get the slides? Yes, you can get the slides. We are going to send them out after, and also we have a handout for you on reopening, a checklist that we put together that we'll be sending out after the recording. So so look for that in a separate email. We also are going to have this recording on our YouTube channel. You are feel free to subscribe to our YouTube channel. It's something we're trying to grow. Also, please feel free to share it with your networks. Our goal is to be able to provide you as many resources as possible to support your process. That's what Connect Consulting is all about. So I'm going to now introduce you our speakers. Here we go. So we have, I'm leaving you in able hands. Again, I'm Nora O'Brien, CEO of Connect Consulting, but you've got some great speakers today. Amanda Cooper, do you want to talk a little bit about your background?
Sure. Good morning, everyone. Thanks for joining us. Again, my name is Amanda Cooper. I'm a planning specialist here at Connect Consulting Services. I hold a master's degree in public health. So my joke kind of right now is that I've been planning for this pandemic my whole life. Before coming to Connect Consulting, I actually was a senior advisor for FEMA, the Federal Emergency Management Agency, where I worked and was the lead advisor on inclusive emergency management and access and functional needs for 10 major disasters. Before going to FEMA, I was a public health emergency manager with the state of Alaska, and I'm also an adjunct faculty member for the FEMA Emergency Management Institute. I'm a certified ADA coordinator, a certified ADA professional, and as I mentioned, I have a focus on public health and access and functional needs.
Great, awesome. We also have Karen Garrison.
Hi everybody. Hopefully everybody's having a good morning. We're in California, so we are in the morning time. My name is Karen Garrison. I'm Director of Aging Services for Connect Consulting Services. The majority of my career, I spent directing programs for nonprofit organizations, mostly in the San Francisco Bay Area. And I've led both community-based and clinical services, so skilled nursing facilities, memory care, residential dementia programs, adult health centers. In California, those are called community-based activity services, supported senior housing, clinical case management, senior centers, and national service programs. So this, my background is a real deep dive into aging services programs, and I bring that experience to Connect, where I lead a number of different projects, and we're going to get right into the into this webinar. Thank you so much.
Okay, so we want to talk about, these are the things we're going to talk about today. First, we want to look at where we are today with COVID. So I'm going to give you a little bit of analysis as of yesterday on where the world and the United States stands with regard to COVID confirmed cases as well as deaths. We're going to go over some general guidance that is available out there from the CDC on reopening your business and reopening schools. We're going to look at if you're ready to reopen. There are some crucial elements that must be met before businesses and schools should make the decision to reopen. And then we're going to look at after you reopen. So you've reopened, so now what? What other things need to continue on to ensure that we are doing the best to manage this pandemic that will continue? And then last, we're going to do a deeper dive into, Karen's going to do a deeper dive into reopening schools and some strategies and things that you should keep in mind when reopening educational facilities. So next, we're going to look at COVID today. And this was actually from yesterday. They haven't updated the website yet today. So we're looking at the United States. And as of yesterday, there has been 106,028 deaths and a little over 1.8 million confirmed cases. Now, when you look worldwide, of the top 5 locations with the highest confirmed cases, the United States holds 4 of those locations. We have New York, New Jersey, Illinois, and California are all in the top 5, and Moscow, Russia is actually in there as well. So for example, we want to look at, I wanted to look at the state of New York and how many cases they have. So I was looking at, they have a case fatality rate, which is just over 8%. Now, this is different from a mortality rate, as a case fatality rate measures how many people who have been infected have died from the virus. The mortality rate is different in that it tells us the likelihood that anyone, whether or not they are infected, will die from the virus. So it's important to keep in mind that the case fatality rate is not the same as the mortality rate, but that's still a significantly high case fatality rate at 8%. I'm not going to go too in depth with the analysis, you know, that's a real deep dive into epidemiology, which isn't the intent of this webinar, but I just wanted to give you that information for descriptive purposes to show you kind of where we're at as a country right now. Oh, and as well, if you'd like to look, this is the Johns Hopkins dashboard. If you're interested in seeing where we are and following that, the titles of the slide, the COVID-19 today, that's actually a link to the Johns Hopkins dashboard. So if you're interested in looking at that later, you can easily access it through this slide. All right. So when there's a pandemic going on globally, the World Health Organization, or which is referred to as WHO, they've developed these pandemic phases to kind of gain insight into where we are and where we're going. So right now we're still in phases 5 to 6. We're still in the middle of a pandemic. There's been widespread human infection, and based on what is happening in our country right now, with more businesses reopening and other things going on with mass gatherings, I wouldn't be surprised if there is going to be a surge in infections, whether it's soon or whether it's this fall. So that's something to keep in mind, that we're not done with COVID. You know, the stay-at-home orders and the quarantining and things of that nature have really helped. But it wouldn't be surprising if there was a surge of infections later this year. So keep that in mind. So now let's go into some of the general guidance that's available. So the Centers for Disease Control and Prevention, or the CDC, is a wonderful resource. I mean, they are the national public health experts on pandemics and what's going on in the world. So they have some guidance about reopening. They encourage any business or school to reopen to develop a plan that is specific to your workplace or your school. All workplaces are going to be different, whether you are an owner of a restaurant or you are the owner of a company where it's an office environment. You really have to tailor your reopening plan to your workplace. You need to identify all areas and job tasks that could potentially expose your staff and students to COVID-19. So that we'll talk about that a little bit more in depth as we go. And also, your plan needs to include control measures to eliminate or reduce exposures to COVID. The CDC also provides some great guidance on social distancing in the workplace as well as schools. Examples of that, and we'll do a deeper dive into these a little bit later in the presentation, is to have flexible work sites, flexible work or school hours, and prohibiting handshaking and other sorts of greetings that require you to have contact with another individual. So next, let's go into whether or not we or you are ready to reopen. So there's certain criteria that needs to be met. So are you eligible to reopen at this time? And again, we'll go into a deeper dive of all of these. Have you developed a reopening team to look at and prepare your organization, your business, or your school to make sure that all the criteria are met and that you can safely reopen? Have you met the requirements to reopen? That's going to vary among your jurisdiction, whether it's a state, whether it's a city or a county. Those requirements are going to be different, so you have to keep that in mind as well. And then we're going to go through some reopening checklists and look at whether or not these certain items have been completed, because that will prepare you and give you a better idea if you're ready to reopen. So first, let's look at reopening eligibility. And again, as I mentioned, it's really individualized to each state, each county, each city. So you want to make sure that if you reopen your school or your business, make sure it's consistent with your state and local orders. Here in California, we do have state orders, we have county orders, and they vary. Some counties are farther ahead in the process of reopening, whereas some counties have not reopened due to the number of COVID cases within those counties. And then also, are you ready to protect employees who are at a higher risk for severe illness? Are you in a place where you can ensure that your staff and your students are as protected as they could be and that you limit exposure to COVID? Next slide. So first, let's talk about your reopening team. So something that's really important is that you identify individuals who can serve not only as the reopening team, but have some ongoing responsibilities. So when you have those roles and responsibilities, it's recommended that you include staff on your team from each of these 4 areas, from operations, human resources, legal, and information technology. So what's interesting is, and something that we recommend is, when you're developing these roles and responsibilities and you have your identified members, you can actually fit those into what is known as the incident command system. And that is a standardized incident management structure that is used throughout federal government, state government, county government on managing an incident. So for example, the head of a disaster is called the incident commander. So that could be someone from your operational area. And operations could also include a safety officer, someone that can monitor and make sure that all the safety precautions are being taken after you reopen. You also would need to have someone from human resources that could serve as your finance and administrative lead to make sure that you're keeping tab of costs that are associated with reopening, any extra costs that you're going to have, as well as keeping track of staff and things of that nature. And then last, in the incident command structure, they have advisors. And so your advisors in this area could be your legal advisor or information technology advisor. So next, once you have your team identified, you want to look at developing a reopening plan. So one of the first things you need to do is conduct a hazard assessment. And that basically identifies all tasks and areas that are susceptible to exposure. So you really want to look at those high touch points, doorknobs, coffee machines, copy machines, things like that. So you really want to identify that and determine how you're going to include control measures to limit exposure with those high touch items. And then last, you want to develop your social distancing policies and procedures. And that's going to be really important as you bring staff back or students back into an environment where there is more than multiple people. Okay, so next, let's look at reopening requirements. So there's going to be health and safety actions that need to be completed. So one thing you want to do is you want to assess your essential functions of your business or your school and the reliance that others in the community have on your services or products. You want to be prepared to change your business practices if needed, to maintain critical operations. You also want to plan for ongoing maintenance within COVID, so that yes, you've reopened, you've followed all the guidance, but it doesn't stop after you reopen. It's going to be something that's ongoing for a long period of time until COVID has a vaccine and it's we've reached those later stages of the pandemic. As I mentioned before, you want to conduct your hazard assessment to identify those areas that could increase exposure for your staff and students. And as I mentioned before, review your essential functions. One good thing to do is identify your alternate supply chains. And if your company or your business contracts for temporary employees, you want to talk with them about the importance of sick employees staying home. You want to talk with other business partners about your response efforts, share the best practices and what's working for you. And then when you resume your on-site business operations, you want to identify and prioritize job functions for continuous operations. Okay, so here we're going to look at your reopening checklist. And this is a list of items that has been recommended that you make sure that you have completed before you reopen and bring staff or students back. You want to make sure you've sanitized your workplace or school. You're going to have to modify your layout because pre-COVID, we were all in very close proximity with each other. And that was a normal day-to-day thing, but things have changed. So we're moving into that new normal where being so close together is wise at this point. We want to look at, can you flex some work or school schedules? How available are your staff to come to either to school or to the workplace? How are your staff getting to the school or workplace? Are they using public transportation, which could increase their chances of contracting the virus? You need to look at personal protective equipment or PPE within the workplace or the school. You want to make sure that before you bring your staff or students back to the workplace or the school, you want to make sure that they are aware and educated on how things are going to be different once they return. And you also want to let your clients know so they're aware of what to expect when your business reopens. And then again, we want to talk about, as I mentioned before, there could be a surge of infections later this year. So you need to have a plan in place of how you're going to address that. So first, we want to talk about the sanitized workplace or school. So first, you need to determine actually what needs to be cleaned, because the CDC has recommended that not everything needs to be cleaned. So some surfaces only need to be cleaned with soap and water, as surfaces and objects, surfaces and objects that are not touched frequently. Again, as I mentioned, not everything needs to be sanitized. So for example, ceilings aren't touched frequently, so soap and water is adequate for that. You also want to make sure that disinfectants should not be used on items that could be put in the mouth if children are involved, because those can be toxic to children. So cleaning children's toys or anything that they can reach can definitely pose a threat to their health. So items such as pools, hot tubs or spas, and water play areas have no evidence to support transmission directly to humans. So regular maintenance on those items is sufficient. You don't need to go into deeper dive on those. And if your workplace or business has been unoccupied for 7 days or more, it will only require normal cleaning, as the virus that causes COVID-19 has not been shown to survive on surfaces longer than the 7 days. Next, we want to look at using the Environmental Protection Agency EPA approved products. And there's a link there, the EPA approved products, to make sure that the products you're using are effective against COVID, because some may not be. And like I said, the list can be found at epa.gov. First, when you're cleaning, you want to clean with soap and water first, followed by an EPA approved disinfectant. You want to clean and disinfect all workspaces, classrooms, and common areas. Those would include bathrooms, meeting rooms, reception areas, things of that nature, and all surfaces, desks, tables, and objects such as telephones and keyboards need to be wiped down and disinfected, not only before you reopen, but also on a regular basis. And then depending on the makeup of the item, there could be special cleaning that's required. So if, for example, there's a different cleaning requirement for hard and non-porous materials or items versus soft and porous material or items. So hard and non-porous materials would be things like glass, metal, or plastic, and soft and porous materials would be things like carpet, rugs, and seating. And those recommendations on how to clean those are all available at the CDC from the Centers for Disease Control and Prevention's website. And last, you need to temporarily modify the building ventilation system. You don't need to pull it all out and sanitize all of it. You just need to maintain regular maintenance. No special cleaning is required. But some things to keep in mind that could help is you may want to increase your ventilation rates. You may want to keep the system running longer, 24 hours a day, 7 days a week if possible, because that will enhance air exchanges in the building space. And then you also want to make sure that you check your filters to ensure that they are within service life and appropriately installed. So next, let's move on to the layout of your office or classroom. So when looking at the common areas, first, when people enter your building, they're going to come into the reception area. So you want to make sure that you've modified the layout of your space to allow for increased physical distance between staff, students, and other workers. You need to reorganize your floor plan to maximize 6-foot distances. And some of the things you want to ask yourself are, what are the essential needs for space in my business? What are areas that are underutilized today that you could possibly use? Are there any superfluous areas now that people need 6-foot barriers, and how can you reimagine those spaces to make room for today's needs? Also, and you want to ask yourself, what are we using this specific space for? Is it something that can be used differently? For example, if you have a break room, can you turn that break room into a workspace for staff so that they're more physically distanced? And reorganizing your floor plan in your reception area. One thing that's recommended is to control access to your building. So instead of just having your front door unlocked, you want to think about, is it possible to have individuals call in to the business to let them know they're outside, so you can go let them in, so that way it's a controlled access to the building. You want to think about installing temporary plexiglass sneeze guards. I know, at least in California, I've seen those everywhere. When you go shopping, there's between you and the cashier, there's just a sheet of plexiglass to kind of protect you from those droplets should anyone sneeze or cough or anything of that nature. Again, you want to remove or rearrange seating to maximize physical distancing. You want to remove any magazines and pens or any sort of items out there that could be touched by multiple people. And you want to make sure that you keep hand sanitizers in plain view, and as many as possible all around the classroom, the business, things of that nature. So when we're looking at workstations and classrooms, what we need to do is determine how many are actually needed, and if there is a maximum capacity per floor if you have a multi-floor building. You want to close off every other workstation or every other desk, every couple desks, to make sure if they're close together, because that, again, that allows for that physical distancing. If you do close off those workstations or desks, it's important to remove chairs or monitors from those workstations or desks to discourage use of the workstation or desk. You want to assign seating until the pandemic is over. That will allow you to avoid cross-contamination, so you know that each person that's coming into your school or business is using only one seat or workstation the entire time. You want to make sure that all personal items have been removed and make sure that they don't come back into the workplace. So I know it's fun for us to have pictures or little fun things on our desk, but at this time, we need to remove those and take those home, because right now it'll allow for a thorough nightly cleaning. So we need to make sure that it's clean as possible. Clean desk policy. Other options that you can include would be installing panels or shields between workstations, or reorienting workstations or desks so employees or students do not face each other. And then some other questions you could consider: do you have common areas that can be used for individual workspaces? Maybe you only allow staff that need to be on site to perform their work, things of that nature. So when we're looking at common areas, some things to keep in mind and questions to ask could be, do you have common gathering areas? How do your employees or students naturally spend time together, and where? So you want to close off common areas if possible. For example, cafeterias, gyms, things of that nature, unless it's absolutely essential that you need to use it. You want to post signage that can reinforce social distancing, reinforce good hygiene, and indicate whether a room can be used or not. You can either color code the room, so green means yes, red means no, or any other method that you feel comfortable using. Again, you want to minimize high touch points. If it's possible, prop open all doors, or actually remove doors from hinges. If you can do that. Use touchless trash cans so people don't have to touch the trash can to open it. And then you want to remove any coffee makers or reusable utensils, just to limit the spread, the options for things to spread. And then something else to consider is to establish one-way directional hallways to avoid people having to pass each other. Also, it's important, you want to think about designating a separate entry and exit to maximize social distancing and decrease the instances of people closely passing each other. If your building or your school has elevators, it's encouraged to limit the number of people riding in the elevator to 4, and you can kind of spread out and each stand in a corner, so that you're maximizing that social distance. And it's also important to require masks. Something else with elevators, you maybe want to cover the elevator buttons with plastic and replace that often. It makes it a little bit easier. You can also use signs, tape marks, or other visual cues, such as decals or colored tape on the floor, placed 6 feet apart, to indicate where to stand when physical barriers are not possible. And again, utilize video conferencing or for school or in-person meetings. If you have to meet in person, it's important to hold meetings in an open, well-ventilated space while you continue to maintain a distance of 6 feet apart, and also wear face masks. Okay, so schedules. So this works for schools and work. Something you can think about is staggering your end and start times. Can you stagger shifts and breaks? For example, if your business or your school is open 9 to 5, can you change some work hours for some staff from 10 a.m. to 6 p.m. and then another shift at 8 a.m. to 4 p.m. So you're minimizing the amount of time that you have full staff or all students in one place. Can you return to work or school in phases? For example, can you consider bringing back employees that have essential duties first, and then slowly bring back those others that need to perform tasks that cannot be done from home? Also, can you alternate days? Can you utilize telework or video conferencing for school on alternating days so you could decrease the number of staff or students in your building every day? Continued work of telework or remote classrooms. If you can still have employees work from home and students participate through remote classrooms, that's encouraged as well. Consider having compressed work schedules. You could have employees work longer shift to allow for additional days off per week. So for example, you could do 4 10-hour shifts instead of 5 8-hour shifts, so that the individuals get there's 1 day off for each individual every week. And again, you want to look at your leave and absence policies. You want to make sure that those policies accommodate staff and students that are following guidance to stay home. So if we're looking at staff, so this applies to school staff as well as business staff. So you need to think about, do you have family members that, or do you have staff that have family members that require ongoing care in the home? They may not be able to return to work as quickly as possible. You also may have staff who are considered high risk, those with compromised immune systems and things of that nature, who are more likely to contract the virus easily than those who are not high risk. You need to think about your staff that utilizes public transportation. And also, you're also going to have staff that are just afraid to return to work. They're afraid to come back into an environment where they could possibly contract the virus. So transportation. So if you have staff that use public transportation, are you still expecting them to use public transportation to get to and from work, where they're exposed to large numbers of people? Do you plan on using buses to get students back and forth to school? Again, that will have a lot of people in a small space. You have to remember to social distance in those in transportation as well. So some alternate forms of transportation is having individuals use their personal vehicle. Carpool. Now carpooling, yes, it's more people in a confined space, but it's less people than what would be in public transportation. And utilizing rideshare services such as Uber and Lyft. And again, then they're only exposed to one other person versus 30 on a bus or a train. Can you consider having satellite offices or classrooms where you're able to spread out your employees or students so that they're all not congregated in one localized area? Can you continue to telecommute and have remote classrooms? And also, if you live in a town or a city that's bikeable, that's really good to have them, if they can bike to work, that'd be great too. We'll do that last. Okay, so now let's talk about personal protective equipment or PPE. So we know that when staff or students come back, they're going to need to be protected. So one thing to think about is, is the business or the school, are you going to provide the PPE, or are you requiring your employees or students to bring their own? And in that case, do you have a plan to reimburse them for the purchase of that PPE? Something you could also do is send PPE packages to employees and students ahead of time so that when they arrive at school or their work the first day that you reopen, they already have that equipment in place. Also, you need to think of when you have face masks, what kind of face masks will you require? Are there going to be limits on the design of those face masks? For example, would you prefer them all to be solid colored, or are you allowing your employees to kind of use their own? But keep in mind, there can be some masks that have designs or logos that could possibly be offensive to others and may not present the most professional manner that they are. Also, you need to think about proper and safe disposal of the PPE because it is considered hazardous waste. It's important to have hand sanitizer available. Gloves are great too, but there's been a push against gloves lately as people don't change them as often as they need to. But if you are going to require gloves, you also need to keep in mind that some people have allergies. For example, latex gloves can be an allergen, and certain chemicals that you may have to use when you're cleaning could spark someone's allergies. So that's important to keep in mind and keep that ongoing communication with your staff or students to make sure that everyone feels safe being at work. So now you've put everything into place, you've modified your workout, you've sanitized. Now you need to let your staff, students, and clients know what to expect when they return. For staff and students, you want to, it's important you can develop a virtual tour for them to see that a virtual tour to walk returning employees and students through the modified workplace. You can develop a plan that can be distributed to staff or students that includes the following: how you're going to bring employees or students back, how social distancing is going to work in the workplace or school, what are the new and updated health and safety protocols, and have there been any changes to leave or absence policies? And also, you need to communicate with those you serve, your customers, your clients, your students, and this will be a document that discusses how you will reopen, and what, if any, changes in service that will be in place, and how you're working to protect your staff, students, and clients. And that's something that can be disseminated easily. You can post it on your website. You can also send it out via social media and things of that nature, or via email. I know here in California, one of my favorite restaurants, I've been kind of waiting to see when it will reopen, and they've been posting updates on Facebook, which has been, I really appreciate it. And next, something you need to think about, as we talked about before, is an infection surge plan. So how will you handle employees or students who become ill or come into work ill? Do you have a plan? If someone comes into work and you identify that the student or the individual is ill, do you have a plan for isolating them until they can leave the workplace or school, so that they're not exposing others? You also need to think about your closing parameters. What are the triggers that will require you to close your business or school down should a surge of infections occur? Also, how will you continue to provide essential business and school functions? Will you return to telecommuting, or are you return to online classrooms? So you need to think about how your business and school continuity. Also, we recommend that you develop a relationship with your local health department, as some health departments, and this will vary across jurisdictions, will require that you report that you have a case of COVID. And health departments will conduct the testing and contact tracing, but they may need some of your support in providing them information. So some other considerations to keep in mind. Many small businesses have applied and received a loan through the Paycheck Protection Program, which is a great program. But there's some concern that if an employer brings back employees because they got the PPP loan, is it likely that the employer will let those employees go after an 8-week period just to satisfy the loan forgiveness requirements? So that can be kind of dangerous for the business. If so, if you decide that you're going to close your business after all this has happened, it may be necessary to provide a warn notice to staff. And this is all available on the Paycheck Protection Program website. So it's important to keep in mind. Employees, you may have employees who refuse to return to work. And that's something to keep in mind. You know, there can be issues around return to work and unemployment benefits. And so there are avenues for businesses to contest unemployment claims through their state unemployment agency if you have staff that are refusing to return to work. Are you going to screen staff and students when they arrive? What is your process for sending, again, what is your process for screening them, and what is your process for sending them home if they're ill? And then visitors, will you allow visitors in the workplace or school? And if so, what is your protocol for that? So now let's look at ongoing maintenance. So something that's going to be required is you need to have your cleaning and disinfectant protocols in place, so that, you know, again, not that you only did it when you reopened, but that needs to be an ongoing thing. You need to have regular review of your leave policies. As you know, the COVID virus has been fluctuating, and we never know if if it will mutate and turn into something else. So it's important that you're constantly reviewing your leave policies to make sure that they are appropriate given the situation. Again, you want to continue to evaluate your essential employees and your business functions. And it's really important, schools and businesses, to establish an emergency communications plan. That's really important. All right. Yeah. Okay, so now, again, that you're reopened, now what? So this is your reopening team that we talked about in the beginning. What are their ongoing responsibilities? So there's this great cycle that has been, process that has been identified. So it's a cyclical process. So you want to assess where you're at, you want to act on what you've observed, and then you want to adjust according to any changes that you've identified that need to be made. Again, you want to have ongoing communication with your staff, your employees, your students, and your clients. And you want to implement your business or school continuity plan as needed should the nature of what's going on change. And that's kind of what we have developed for schools and businesses. Now Karen's going to go into a deeper dive looking at how COVID impacts schools.
Hi, everybody. Yes, so we all know that, So we all know that schools have been very impacted by COVID in terms of school closures. Over 500 million students in the US have experienced school closures. So that's really from those infant and toddler programs all the way up to college. And so it's something that really is impacting communities as well, because as kids are not in school, as young adults are not in school, they're coming back. And as sheltering in place is continuing, it just changes the dynamics of, in terms of education, making sure that kids have access to resources so that they continue the educational process. Regular classes were displaced by learning, by distance learning. So that's definitely something. So kids are now on computers. They're looking at Zoom. They're doing Zoom classes. And that may work for middle school to college. However, elementary school, that might be a much more challenging. Schools have supplied students with laptops and internet services needed. And so, as we know, there are wide swaths of the United States that actually have less access to things like their own computers and access to internet. So that really makes a big difference when you're trying to institute distance learning, and then kids and families don't have those resources. So school districts across the country have really taken the initiative to make sure that students to reach out and supply those items to families. Students and their families who normally receive free and reduced lunches are provided with go-to meals. So if you're used to having your kid and you receive free or reduced lunch, and so free meals and free access to food options, and all of it's in schools, which are the hub for those activities, are closed, it's actually pushing school districts to provide those meals and food resources to families when they're not in school. And that's definitely happening across the country, and good job on the school districts doing that. Many preschools and after-school programs are available at this point only to first responders. So those families that have nurses, doctors, really grocery store workers, those first responders, by the way, want to say a shout out for them, because it's not only medical people, it's people who run our grocery stores, who run those delivery services, who deliver our mail. It's all of those, and they have access to those programs and other people don't. And that's just the way it is. It's a prioritization at this point for our society. Lastly, college students had to leave campus. So in March, as high school students were actually doing their coursework and trying to get their degrees, they were asked to leave their universities and continue their education remotely. Okay, so those are some of the impacts to students. So we've come up with these 8 very concrete ways to look at, and this, much of this dovetails with what Amanda is saying. And so you'll see this checklist. That's actually the beginning of a checklist that will be sent out. It's called the COVID planning considerations. That will be sent out with this webinar, with the slides. And so we've identified 8 key areas that you should be looking at. These are questions so that you can ask yourself how they affect your schools. Now, I have to say many of these criteria are also really effective in terms of planning around any congregate program. So this could apply to a senior center that is trying to figure out if they want to reopen. It could be a childcare center. It could be an elementary school. So it's really looking at all these congregate sites that people are going to every day normally and now can't go. So we're going to start out by really reviewing your existing emergency plans. So do you actually have You know, do you have existing emergency plans? We're going to look at metrics. We're going to identify a team. We're going to determine staffing levels, testing protocols, communication strategies, looking at budget. That's always a fun one. And then implementation. So let's go to the next slide. Okay. All right. We always have to start with what we have in place. Whether you be a school district, a senior center, a congregate meal site, whatever it is, do you have existing plans in place that identify ways that you can mitigate some of the issues around being closed and then reopening? Some organizations have those. Other organizations probably need to develop that. No time like the present. And so really it's looking at your existing emergency plans or your procedures, your best practices, your protocols that you normally have now, and seeing what's working and what's not. We don't want you to reinvent the wheel. We don't want you to have to recreate something from scratch. But if there's something that within your existing plans that are working, use that and build on that. Okay, and so it's really looking at how can you take what you have now and modify it to really help you in the reopening process. Next, we're going to review the metrics. Okay, so I think what's really important from the get-go is to decide, A, what those metrics are. Are they county infection rates and mortality rates and fatality rates?
Or case fatality.
Thank you.
Yeah.
Okay. Or is it state rates? Is it what's going on in your immediate area versus maybe in your state? And really even looking at beyond that. So it's determining what are the most appropriate metrics that are most specific to what you're actually doing. We know that kids tend to have less of an infection rate. They are actually getting sicker in different ways. And so those kids who are getting infected may not feel the effects of COVID, but truly the thing that really makes me nervous is when they go to school, they get infected, they bring it home to their entire family. So it's not just, and many families have extended families living, so it may have multiple generations. So you know, kids might be going to school and bringing it home to a vulnerable grandparent or an aunt or a parent, or even a brother or sister that's going through cancer treatment. So that's really important to look at those local metrics, figure out what those are, start tracking them, start seeing what's happening. We know in California, there's areas of California that actually have very low transmission rates and low fatalities. You know, you may have, by looking at those metrics versus LA County or Sacramento or San Francisco, you actually, you know, you may see, okay, well, I'm here, we're here, and they're there. So it's really looking at those metrics, and also in terms of looking at metrics, looking at clinical guidance. There might be within your school district, there's certainly nursing staff. So who can be tasked with looking at those metrics and knowing that they're the right metrics for your district. And so you want to identify what those metrics are ahead, and then start the tracking process so that you understand what's going on. Okay, let's go to the next one. Okay, and actually, and Amanda talked about this. It's really, really important that as you're looking at all of these elements, that you identify a reopening team. I know where I live, it's a large district, and so you have district people, but you also have school administrators. You have lots of different, you know, there's so many different people who support schools. And so I would say make a multidisciplinary team in that reopening team. So you want to have the nursing staff, you want to have facilities, you want to have administration, teachers, and maybe even security. You know, those are some of the areas that affect all schools and all congregate programs. And so making sure that you've got not just the top brass and not just the people that are line staff, you want to kind of make sure that you've got the strata of who supports those schools and those centers, so that you can actually, everybody can have their input, everybody sees it reopening from a different perspective, and so it allows for that free exchange of thoughts. Also, how often are you going to meet? Are you going to meet daily? If things are really hot, you're going to have to really, if you're getting closer and closer to implementation, those daily calls might be what happens. So really figuring out the frequency, how you're going to call. Are you going to call in person? I mean, are you going to do Zoom calls or, you know, conference calls? Are you going to do regular email updates? So kind of figuring that out from the beginning allows everybody to be on the same page, allows everybody to be able to meet that standard, because I'm sure it's a new communication level now than what it was even in the fall. So think about it, like you're going to have to create ways to communicate with in a new way, probably much more frequently. Also, determining reopening staffing levels. You know, I could see that schools especially might be adding a lot more school janitors because of the disinfecting, the new protocols that need to come into play. And so, but are there other maybe services or equipment that will be necessary to actually get you to reopening? So if it's deep cleaning or if it's regular cleaning, if it's creating protocols around that stuff, that's great. Also, do you have any labor issues in terms of union or service contracts that need further consideration? Because I know in some school districts, labor, you know, making sure that the teachers union is in that conversation in terms of those reopening plans makes it a lot easier, because you are really modifying what's going on, especially in middle and high school, you know, at that level, because you're doing a lot of distance learning at this point. Those are actual things that affect contracts. So really making sure that they're in the loop with all of this is very important. And also we're all in it together. So we need to make sure that that team and the staffing is reflective of everybody. And also that, you know, are you going to be able to add or delete staff positions when reopening? I suspect you're going to need more than less. I'll put it that way. Okay, let's go on. All right, testing, really important. Testing, you know, is different from county to county, really from state to state at this point. And is testing available in your local area? Are you able to kind of tap into some of that local data? Are you able to have a direct connection to local testing sites in your area? Is your organization tracking testing outcomes under the quarantine? And lastly, are there privacy policies in place to maintain students, teachers, staffing privacy? Because I think for some people it's very, you know, if they've had COVID, some people are, I had COVID. For some people, they may feel like that's a very private thing. And health privacy is something that's very particular to everybody. And so we want to make sure that we have policies in place where we're not identifying people who have had COVID or who have COVID at this, you know, currently, and that those HIPAA privacy concerns are real. Okay, communication strategies. Are your organization, do you have, you know, strategies in place, public policies that are based on metrics and local and state officials and other factors? And also, what are those specific, what are some of those messages that you would like to convey? Is it around social distancing requirements, wearing face masks, how we use entrances and exits, disinfect? You know, these are all things that people, communication only helps people be more relaxed. If they know, and I know that Amanda talked about this as well, making sure that people are educated about what's going on within your school. You see that in stores now where there's signage up, you know, 6 feet distancing. A lot of that stuff is being reinforced. I think this is as school kind of abruptly ended in March, I think schools are going to have to really think about how they educate not only their staff and teachers and administrators. How do you educate your students and their families? And also, one more thing to think about is that many school districts have kids that speak multiple languages. So how are these messages crafted? Are they, you know, what is translated into what languages? And also cultural competency. So there's a certain, you know, I think it's really important as you're approaching communication strategies that cultural competency is part of that discussion. Okay. Final considerations. I think we missed one. There you go. Testing.
Communications, we're
Oh.
good.
No, we missed one.
It's okay, keep going.
Okay, all right. So final considerations, just so you know that budgets can be impacted by what's going on with COVID. So I want to make sure that organizations can look at their financial resources, and also are there local pots of district resources that can be tapped into. In terms of implementation, we want to make sure that we have established a time frame for reopening, that PPE protocols are in place, and that we want to determine what organizations' new staffing patterns will be needed to reopen. So these are some of the strategies that we've heard about at the local district level that I think will be instituted in the fall. Hopefully the fall will happen the way, you know, it always does, but social distancing will be strictly enforced. Staggered times for students are in school in person. I've heard that at one local high school, they're thinking about having freshmen and sophomores come on certain days, juniors and seniors go on another day, so that you just greatly decrease the amount of people in the actual school at one time. I think it'll be a mix of distance learning and in-person instruction. Daily temperature checks, that will, I can't imagine that's not going to happen. Students may be kept in small groups and in one classroom all day. So you might have it where a high school class or a middle school class stays in one classroom and the teachers rotate in. Also, recess and PE will happen in smaller groups, and they're not going to be doing things like basketball. I think it'll be more soccer, just because dealing with your feet. School buses will pick up less students to allow for social distancing, and frequent disinfecting throughout the school will become the norm. And last but not least, large assemblies and organized school sports will be done virtually or without spectators. Okay, so these are actually some mitigation strategies that we've heard about that will be instituted in some local school districts.
Yeah.
Okay, so our slides get a little teeny bit mixed up, but again, we're talking about budget and financial considerations, really talking to your school finance people or your district finance people are really the way to go. And then implementation strategies, it's really about what do we need to open school on the first day of school so that everybody gets a school experience. And these are mitigation strategies that will help these schools and really any congregate, any group setting open up on time, so that until a vaccine happens, I think these are the kind of strategies that schools will be instituting in order to be able to reopen safely. Okay,
We have some questions, I think.
we have questions.
Yeah.
Okay. Also, if one thing about if there is a secondary surge, which that might happen, proactive emergency planning may be needed if a COVID surge will shut down schools and parts of the economy again. So we've actually called this a materials access plan. We've had several school districts call us and ask about these. And really, let's say you had to shut your school down on Monday and you knew that kids could not get back to school for another month or two. They may need to have a plan in place. We call it a materials access plan, to come in and make sure that they recover their personal items and return textbooks and other items.
Okay, so we had a couple questions. What suggestions do you have for providing patient surveys for patient feedback on services that we provide? Currently, we use iPads or paper survey forms. That's good.
Yeah, this is Amanda. I would continue the use of paper forms. I know that you would think that that would have more people touching them. But as in, like restaurants are doing right now, they have disposable menus. So paper forms are great in that you can collect the data, you can scan it in, but it's not something you have to keep long term. If you want to use iPads, I think that's a great option as well, but you just have to make sure that you are disinfecting and cleaning them between every person. And if they can wear gloves while they're using it, even better.
And you also can consider post, you can also do a post survey to their email. That's another option. And I know there's some systems out there to allow you to do texting. You can do a survey via text so that the person you can send them the link from their, to their mobile phone. So there are some options. You have a couple other questions?
Yeah. Legally speaking, can we ask clients to take temperature? Can we then refuse service if they have a high temperature? None of us in this room are attorneys, so that's a really good question. I know that I have been to several businesses that have required to have our temperature taken, and if you have a fever, they are not allowing you in. But I think that may be on a case-by-case basis, and it may vary according to your jurisdiction. But that's a great question to look into.
Yeah.
I could add just one thing about the temperature is that if you are serving especially a homebound population and they have a temperature, it's about mitigating the risk, and it's about making a plan and getting around that, because if a person does have a high, many center-based sites actually have existing policies around people coming into their center sick, and as well as schools. And so utilizing, again, going back to those emergency protocols and procedures really are the way to go.
So what we'll do is, we didn't get to all your questions. What we'll make sure is they'll get answered in the follow-up. We'll do a follow-up email. This is our contact information. These are our services. We really hope that you were able to join us today and hopefully get a lot of good resources and good ideas about what to do for reopening for your organization and your school. Please, we also have upcoming webinars coming up this month. So one on communication on June 24th, and one that Amanda's going to do on access and functional needs for people with,
it's on inclusive emergency management.
Yeah.
So planning for people with access and functional needs.
Yeah. So thank you so much for joining us today. We appreciate the time you provided us, and we'll be in touch with slides and handouts. Thank you.